acute infectious viral disease caused by the virus A, B, C strains. Virus A and B produces severe symptomatology in the patient, while the C is a mild one and usually infect the children. It is mostly and absolutely inflammation of the respiratory tract, upper respiratory tract and the lower respiratory tract, produces the difficulties and the symptoms in the respiratory system. Diagnosis of the influenza. Almost full diagnosis are the symptoms and the history of the patient and the season, especially it is a seasonal disease. The incidence is during winter season. Then in order to detect the complication of the influenza, we perform imaging tests, that is plain X-ray chest and CT scan of the chest, to detect the pathology in the lower respiratory system, that is the pneumonia and the acute respiratory distress syndrome. Blood culture test is performed to detect the viremia, the types of the virus in the blood. Then the nasal and throat secretion test by taking the swabs of the secretion and the mucus present in the nose, nasal cavity and the oropharynx. Prevention of the influenza. Although influenza is self-limiting disease, it fades away within 1 to 2 weeks. But the patient has to take care of his health, good ventilation, healthy diet, isolation, avoid cold drinks, to keep the social distance of 2 meters, because the virus can only survive within 2 meter distance. So the person should take at least 2 meter distance with the other healthy patient, use of mask, gloves, especially during coughing, sneezing and especially general conversations, use of the mask by the patient, also the other person who are in close contact with the patient, especially the healthcare provider team, nurses, dispenser, hospital staffs. They must keep distance of at least 2 meters away from the patient. Avoid direct contact with the patient and the articles of the patient used by the patient's utensils and other articles in the rooms of the patient, because the secretion of the patient containing the virus that drop over those articles, if the healthy person touches and then it touch the mouth, eye and nose, the viruses get entry in the blood of the healthy patient. So these are the fomites, and the virus of the influenza can survive up to 3 to 4 hours after fall to the dead articles. I mean the bed sheets and the toothpaste brushes, shaving articles, utensils, glasses, cups. So the healthy patient should not directly touch these articles used by the patient. However, if he has to do this, then he should use gloves, and the foremost preventive measure is hygienic hypothesis, that is frequent washing of the hands by the patient and the person in contact with the patient by soap water. This is a very vital and elementary step to avoid the spread of the influenza. Good diet of the patient: soups, milk, eggs, warm distilled water, good ventilation, airy rooms, nebulization of the patient, especially elders and the children, steam inhalation to avoid the irritation in the respiratory tract produced by the inflammatory process, regular sun bath in the early morning. These all steps produces the early recovery and the reduced spread of the influenza in the society. However, when there is an epidemic of the influenza, then the affected person should be isolated. Healthy person should avoid the places of public gathering, parks, cinemas, school, hostels, and similar gathering places. Tobacco smoking aggravate and exaggerate the cough and the irritation and the inflammatory process by the influenza virus in the respiratory tracts entry. So these are the basic and the essential steps to maintain the health of the patient and to save the other ones in contact with the patients.